Ask the Messengers, the program that deals with substance abuse, real people telling real stories. Where there is addiction, there is a chance for recovery. We're trying to help save lives on Ask the Messengers.
May is Mental Health Awareness Month, and according to the World Health Organization, approximately 1 in 4 people worldwide will develop a mental illness at some point in their lives. Today on Ask the Messengers, we go a little deeper into the importance of doing everything you can to take care of yourself. You will hear from a few famous people, medical professionals, and others offering their perspectives on how to handle moments when you are feeling less than. You will also hear from people who have survived mental trauma and how they are coping with life on life's terms today. Ask the Messengers begins now. Growing up, many of us at one point in our times wish we were rich and famous. We wanted to be a celebrity. I remember myself, when I grow up, I want to be a star, but not even having a clue what being a star really meant. But let's just let you know that all that glitz is really not glam. Here are a few celebrities who share the other side of the glitz that is not so glam.
I found that with depression, one of the most important things you could realize is that you're not alone. You're not the first to go through it. You're not gonna be the last to go through it.
I was so unhappy last year. I was so unhappy and I was so joyless.
And sometimes don't want to get out of bed in the morning.
I was evicted when I was 14. We were kicked off the island. We couldn't live in Hawaii. Had no place to live. My mom and I came home, and I'll never forget, the rent was $180 a week. And there was an eviction notice on the door, and this was the final eviction notice. My mom started crying, and I never forgot in that moment. It was a seminal moment for me because I felt like I never want to be in this position again.
Mom sat me down and said, she's a nurse, and she said, hey, just so you know, I have anxiety and depression, so did your grandma. If you ever start to feel these feelings, let me know. There are plenty of people to talk to. There's nothing you should be ashamed about. There are many different ways to handle it. You could.
I was in Berlin and I was alone in my hotel, and I remember there was a window right there, and I remember crying because I was thinking about how the way that I was gonna die was I was gonna do it. Be too dark, but I genuinely didn't think I would make it to 17.
You didn't think you'd make it to 17?
No.
But did you think that you would do something to yourself?
Yeah.
You did?
Mm-hmm.
So why do you think you didn't?
My mom.
Yeah. Your mom.
Please take care of yourself and be good to yourself and be nice to yourself. Don't take that extra step and hurt yourself further than you can, and you can't take it back.
Talk to someone. You could, sometimes it can be not cured, but you balanced with exercise. Sometimes you might need a medication. And I have to keep a really strong exercise regimen, and I am on a medication, and all of these things are what make me me. I'm not ashamed of them. I've realized that they, facilitate the life that I want and need to lead.
Hold on to that fundamental quality of faith. Have faith that on the other side of your pain is something good.
What does mental health mean to you?
I think it could be positive or negative, I'm pretty sure. If you're positive, then you're happy with who you are and what you're doing on your everyday life. And then negative, maybe you have anxiety or other problems.
Everyone has ups and downs. Everyone has happiness and sadness in their life, and hard times and good times.
Mental health to me means more than just mental health, but physical health, and incorporates emotional, social, spiritual health, all kind of in one package.
If you know you have a sprained ankle, you're probably not going to walk around it all day. Just like mental health, if you know you're feeling a little down, you're going to do something about it, as opposed to just kind of walking around on it all day.
Mental health is a state of balance where our thoughts, our feelings, and our behaviors are all positive, and where we're able to cope with all of the stressors presented to us every day.
I am a mother.
A father.
Son.
Daughter.
Brother.
A sister.
I am a student.
A stay-at-home mom.
Construction worker.
Volunteer.
I am loving.
Smart.
Funny.
Generous.
Way too generous.
I am all of the amazing things you see.
But there's something you can't see.
Or don't see.
Something that I don't let anybody see.
Like when I'm alone.
In a room full of people.
I can't get out of bed.
And maybe I've gained weight.
Or lost weight.
Why do men always lose weight?
It can get dark in here.
Really dark.
Addicted to food.
The web.
Work.
Sex.
Alcohol.
Something to take the pain away.
To feel happy.
To feel something.
Anything.
Nothing.
Because depression isn't a mood.
It's not a passing thing.
Or a bad day.
It's a disease.
I can't just get over it.
It feels like I'm underwater.
Drowning.
And sometimes I think you'd be better off without me.
I am telling you this. All of this.
Because I need help.
And you are my wife.
My dad.
My husband.
My kids.
My boss.
So please, don't judge me.
Leave me.
Fire me.
Please, be patient.
Don't give up on me.
Just be there for as long as it takes.
Just because you can't see it doesn't mean it isn't real.
If something has a stigma attached to it, a lot of people think that it's something to be ashamed of.
We'll be right back with more of Ask the Messengers.
Would you like to help us save lives? You can do so by partnering with us here at Ask the Messengers by making a donation of any amount. The people in your communities need your support. Help us extend our reach and impact more lives. Supporting our organization is as easy as a click of a button. Just visit our site shown on the screen from your phone or computer where you will see a yellow donation button. Ask the Messengers is waiting on your partnership, and your community is waiting on you.
Stigma is society's negative attitude or judgment around a stereotyped group. So if something has a stigma attached to it, a lot of people think that it's something to be ashamed of. There are various stereotyped groups, such as age, race, physical illness, physical disabilities, and what kind of stigma is somebody experiencing if they have a developmental disability, gender identity, sexual orientation. People are even discriminated against for their physical appearance or if they've dealt with addictions issues. I'd like to focus on mental illness stigma. When I say mental illness and we think of those stigmatized images, those negative perceptions, what do we really think about? I get many answers in the classrooms and the community from people who are participating in my presentations, and they say things like the scary guy in the asylum with the pale pajamas when they're thinking of those stigmatized views. People often point to homelessness. They think, well, if somebody's homeless, then they must have a mental illness, that these things go hand in hand, when really, this is just a negative stereotype. There have been some developments with Halloween costumes over the years. A certain Halloween costume that I saw could have been named Psycho or Zombie Butcher, when really, the official name of it, as sold on shelves, is Mental Patient. It's just a Halloween costume, many people will say. However, I feel that it's just generating hate and can cause a lot of disrespect for people who are dealing with these conditions. This does not represent mental illness in a realistic way. There are many misrepresentations when it comes to the media. When we think of movies or television shows such as Criminal Minds, this is when the murderer always has some sort of mental illness. I understand that it's art and fiction, but truly it's putting forward a portrayal that is the furthest thing from the truth. What I'd really like to do is to talk to you today to stop stigma, to give you the realistic facts. And a great way of stomping out stigma is to talk about people's personal stories. One person that I truly admire is Demi Lovato. Yes, she is a pop singer and superstar, but that's not why I share her story. Demi is really amazing because a few years ago she came out on national television and she admitted that she has bipolar disorder. She even talked about her addictions issues and the fact that she was suffering also with anorexia. Demi became a great advocate for mental health. She had a whole worldwide concert series tour dedicated to creating awareness about mental health, especially amongst her fans. And then there's Dwayne "The Rock" Johnson. Dwayne, yes, is a former wrestler, actor, and producer. However, one of the things a lot of people don't know about The Rock is that he was diagnosed with depression. He was interviewed in a magazine some time ago, and he said this: "I cried so much that I couldn't cry anymore." He went through such a terrible time, but he reached out and he got the help that he needed. In our society, it is often very difficult for men to reach out for help with their mental health and their challenges because they'll be seen as weak. But I just feel Dwayne is really inspiring because he inspires men and women alike to reach out and to know that reaching out for help is actually a really strong thing.
I have a diagnosis of schizophrenia.
I had depression. I had a miserable, horrible life for many years.
I also happen to have been diagnosed bipolar 1 disorder.
I'm also someone who suffers from chronic schizophrenia.
I suffer from borderline personality disorder,
major depression and anxiety.
I live with bipolar disorder.
My dad suffered from depression and anxiety.
My sister has bipolar disorder and my nephew has schizophrenia.
Mental illness strikes with a two-edged sword. On one side are the symptoms and the stress and disability.
My dad committed suicide because of those feelings of anxiety and depression.
So I went from practicing law on that Friday to being in bed for a number of months.
On the other side, though, is community's reaction to illness, the prejudice and discrimination that makes up stigma.
Stigma happens because they're members of a group that are feared, despised, loathed.
Stigma sucks.
Stigma has impacted my own confidence.
I just thought I was abandoned, ignored by people. I've come to learn that it's a very common occurrence with people with mental illness.
The stigma, the version of what it is to be mentally ill, has cost me 2 of my siblings out of 3.
It's woven into the fabric of our society, and it stems back centuries, really, when mental illness was considered a character flaw.
There's such a bad stigma attached with having a mental illness or showing a symptom of it, and it's just not okay. Not in the high schools, not at all, actually.
Every life is touched by mental illness.
It doesn't matter if you're black, you're white, you're a man, you're a woman, you're young, you're old. It affects all of us.
In very personal ways.
People who have a mental illness are excluded and treated unfairly. And this is because people are afraid of mental illness.
In the long run, stigma produces a kind of isolation that grows from fear.
As a kid, my dad would vanish into the ether. No one said anything. I learned later, no one was allowed to say anything.
Silence helps perpetuate the stigma surrounding mental health and suicide.
The conversation simply needs to start.
When we just open up the conversation and begin speaking about it, it's amazing what can happen.
It's okay to talk about it.
Talk to others.
Talk about these things.
Talk out loud without fear.
Because as long as stigma exists, it prevents the society as a whole from incorporating these illnesses into a dialogue.
And the less stigma, the more people will seek care and get the treatment that they need.
As millennials, we know the power our group can bring to cause social change.
And by connecting with millennials in social media
to end the stigma of mental illness,
we can make a real difference.
We have to be the generation to really normalize and get people talking about it, because if they don't, nothing's gonna change, and we need it to change.
I'm here today because I got the right help, and you can do it too.
Stay tuned for more of Ask the Messengers.
Would you like to help us save lives? You can do so by partnering with us here at Ask the Messengers by making a donation of any amount. The people in your communities need your support. Help us extend our reach and impact more lives. Supporting our organization is as easy as a click of a button. Just visit our site shown on the screen from your phone or computer where you will see a yellow donation button. Ask the Messengers is waiting on your partnership, and your community is waiting on you.
Hi, this is Dr. Jenny Byrne. I'm an adult psychiatrist, and today I wanted to talk to you a little bit about things not to say to someone who is depressed. This is a tricky subject. We all, or most of us, have known someone that's been severely depressed some point in their life, and we want to help, especially if it's a loved one, and we want to say the right thing. So here are 5 ideas about things you should try to avoid saying, and I'll explain a little bit why. The first thing I would avoid saying is that everyone has bad days. Sometimes people say this to try to show their empathy or, that they understand. But depression, real clinical depression, is different than a bad day. Typically it lasts for 2 weeks at least. You have a lot of symptoms associated with it. Yes, it's definitely true. Everyone has bad days, but this is more than just a bad day. So when you say that, maybe you're trying to be helpful, but it comes off maybe that you don't really understand. Number 2 thing, try to avoid saying, is that this will get better. That may be true even with episodes of clinical depression. If you give it long enough, a couple months or a year, it sometimes will get better on its own. But often it won't. And having some help to get through it, whether that be talking with someone, some therapy, medication, whatever is the best treatment option, that will really speed recovery. So just saying this will get better on its own, yes, it might, but that might take months or even years, and that's really a long time to be depressed. Okay, number 3, this is a real common one. People say, I understand what you are going through. And again, they're saying this to try to be empathetic and be sympathetic and understanding and warm. But if you haven't been clinically depressed, you probably don't really understand what they're going through. And even if you have been clinically depressed, what it felt like for you might be different than what it felt like for them. So saying that you understand isn't really the most helpful. You could always say, help me understand, or tell me what it's like, or an open-ended question like that. That's going to be much more productive. Number 4, I've heard this one before. You just need to snap out of it. That's not really very helpful. Obviously, they can't just snap out of it, or they probably would have by now. I think when people say things like that, it comes from a background where, maybe the family wasn't encouraged to talk about feelings, or just that's kind of their personality. But that comes across as very harsh and sometimes a little bit judgmental. So I would definitely avoid saying that. And then number 5, this one I hear a lot, is kind of, well, think about all the good things in your life. And this is said in again, trying to be helpful way, that if the person is depressed and they think about good things in their life, they'll feel better. And this may have a little grain of truth in it. You can feel better. But with depression, often what you see is that people have distorted thoughts, meaning that they tend to overemphasize the negative in everything. And just pointing out the positive typically won't overcome those thought distortions. So again, with treatment, either with talking or cognitive behavior therapy or medicine, those thought distortions tend to change. And that's when they're able to really process positive as well as negative. So just a quick review. Number 1, everyone has bad days. Number 2, this will get better. Number 3, I understand what you're going through. Number 4, you just need to snap out of it. And number 5, just think about all the good things.
Well, that concludes this week's episode of the Ask the Messengers TV show. May is Mental Health Awareness Month, and we hope that the information that we've shared with you over the past couple of weeks gave you some hope. We all suffer from something, and it's so important to stop the stigma against things and stop judging people. Like the lady said in the show, don't say it's going to get better, because in my mind, if I'm depressed, I don't see that better. But what you can do is say, hey, Why don't you call somebody? Here's a phone number. Maybe they can help you. Because I'll tell you, when I stopped drinking, 2019, December 22nd, that's my sober date. I'm going to ride with it by the grace of God. When I stopped drinking, I thought that that was the beginning to all my problems solved. You know, because when I was depressed or struggled, I would reach for the bottle. I would drink until I pass out or drink until I didn't have to worry about what was going on anymore. But guess what? You sober up and that problem is still there, if not escalated, depending on what you did while you were drunk or what I did while I was drunk. But as we told you in the episode today, we have to stop the stigma because mental health is real. And there are a lot of people who are suffering in silence. But we have to be there. We have to listen to our family members. We have to listen to our friends and watch out for some signs and signals. If there's somebody that you used to talk to all the time and all of a sudden they don't answer your call or they don't text you back, check on them. Check on your people, as they say. Check on your people. Because there are so many smiles that are really sad on the inside. People, let's stop suffering in silence. Yes, May is Mental Health Awareness Month, but guess what? Mental health exists 24/7, 7 days a week, 12 months out the year. There's not a second right now, somebody's watching this that's suffering in silence. I'm here to tell you, you don't have to suffer in silence. I chose not to suffer in silence. I seek the therapist. I needed the therapy. Therapy is okay. Therapy is okay. It has helped me so much. Some days I get on there, I talk my head off. Some days I just listen to my therapist and she gives me tools to use. So we have to take control of our own mental stabilities. There is help. Reach out. You know, when Jessica Starr, Fox 2 News lady, when we found out she had committed suicide, I still can't believe it. It still pains me. It still hurts me. You know, and my prayers constantly go out to her Fox 2 News family because I can only imagine. You come to work with somebody every single day, and one day they're not there because they took their own lives. E! Entertainment, Chelsea Chris, pageant winner, had a good job, beautiful. All those factors didn't matter. You know, don't look at somebody like the celebrities that we saw today. Don't look at the celebrity or the person next door to you and think that they're okay. So we hope that you will join us and stop the stigma. Mental health is real. Please, if you are, stop suffering in silence. This is Tina Nelson for the Ask the Messengers TV show.